Good morning, it's 4:30 and it's the first day of clinicals.
If you're about to have your first day of clinicals, this is my tip for you. Also, I'm carpooling with my friend today, and I made her a coffee since she's driving.
I'm gonna drive to my friend's house, which is like 20 minutes, and then we're gonna carpool from there, and then it's gonna be a 45-minute drive.
When you are being oriented by a clinical instructor, really try to watch and listen with the intent to memorize it. My goal is usually to be as useful as possible. When you're in the supply closet, try to look at as many labels as you can so you know where everything is. This way, when your nurse forgets something or needs you to get something, you know exactly where to go. Get the chart and keep in mind when vitals are due, so you can offer your nurse to do them when that time arrives. Try to be observant of your nurse's routine. For example, I noticed that every patient has a whiteboard with patient information on it. But when my nurse had a new admission, I could offer to fill out the whiteboard and take care of the patient's vitals.
Okay, I finished clinicals. I'm back in my car. It was about 8 hours long, but I actually had so much fun. And I got to watch a bladder ultrasound. I got to watch the nurse put in 2 IV piggybacks and change the IV site from the right hand to the left side. I also got to help with wound changes, and it was actually really interesting seeing how like an infected wound looks like, and it was very moist, very wet, very drippy. It was very interesting. At first I felt like my nurse didn't know what to do with me or how to use me, so I started to offer to fetch things for her whenever she forgot something, even if I didn't know where it was, because like it was my first day actually fetching things from the supply closet, and there's a lot of stuff. And there's like 3 closets too. So even if I didn't know where it was, I always knew that there was nurses going in and out of these closets. So I would catch one that was just close by and just be like, oh, could you point me to where the gauze is? Could you point me to where blah 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 is? And really quickly I got the hang of where everything was in like the general aspect. So I was able to get more supplies quickly and more efficient. And then after that, my nurse started asking me to do a lot more tasks for her, and I felt like I was more involved with the care, and I learned a lot more after that. Also, I got to wean a patient off of O2 today. So like being able to play around with like the oxygen liters and like the nasal cannulas and things like that was one of my first experiences in a clinical site, and I thought it was interesting.